Welcome to our role play video. In this video, we are going to discuss inhalers, medication by puffer, Flovents with an aerochamber. Flovents are used to prevent the release of substances in the body that cause inflammation. Flovents is used to prevent asthma attacks, but will not treat an asthma attack that has already started. It should not be used if the individual has allergies to milk or proteins. And all inhalers are handheld portable devices that deliver medication straight to the lungs. The right inhaler is essential, and it can help the patient to get the right dose of medication, and that will also prevent further heart attacks.
Hello. Some advantages of inhaler would be it has a rapid drug action. Strong drugs can be given in smaller amounts, which minimizes side effects. It is also convenient to carry along with you. You can put it in your bag and your pocket. Some disadvantages are, if not cleaned properly, it can be a source of infection. And it also requires cooperation of the patient with proper breathing techniques for effectiveness. Serious side effects may occur from sudden drug doses. Patients may also become dependent on this type of medication.
Inhalers are commonly known as puffers. The way you use it is to spray the medicine out and breathe it into your lungs. Inhalers deliver medicine very quickly. Inhalers are compact and light. It is very important to use your inhaler the correct way to make sure the medicine gets deposited into the lungs where it can work best. Incorrect techniques can leave some of the particles from the medicine on your tongue or throat where it won't help. A spacer or holding chamber, it is an attachment that should be used with the medicine. How to correctly use a spacer and mouthpiece: you first remove the cap piece of your inhaler. When you get a new inhaler, you need to prime or waste it by spraying the medicine into the air 4 times. Then you fit the inhaler into the opening at the end of the spacer. Shake the inhaler well for 10 seconds and turn your head to the side and breathe out. Close mouth around the mouthpiece of spacer. Push down on inhaler. Once the medicine is inside the spacer, right away take a slow, deep breath. The goal is to not hear a whistling sound. If you do, that means you're breathing in too fast. Hold your breath for a count of 10 seconds. Now slowly breathe out. Rinse your mouth with water or brush teeth after the use of the medicine.
Hey Paulina. Hi. So I know you feel a bit nervous about using the aerochamber, but I want to explain to you a little more about what it is. The aerochamber is a spacer device that makes it easier to get more of the medication from an inhaler into your lungs. The chamber holds the medicine so that you don't have to press the inhaler and breathe in at the same exact time. The chamber also reduces the risk of side effects from your medicine. It also slows down the speed of medication until the person is ready to inhale.
That makes me nervous.
Alright, well, I'll demonstrate to you how to use it so you know what to expect. This will make you less nervous about the situation because you'll know as much as you can about the aerochamber before you do it. That way there isn't any surprises. Before I demonstrate, I first have to check to see if it's the right person, the right medication, right amount, right time, right route, right documentation. Okay, perfect. So this will use the aerochamber. So first we're going to pop it open, spray it 4 times, attach it to the aerochamber, and then shake it for 10 seconds. Then you put it to your mouth, press the inhaler, and then breathe in slowly.
Well, that makes me feel a lot better.
When taking the medication, make sure to not smoke, wash your hands before you use it, and when you're done. Properly clean the equipment to prevent infections. Rinse mouth after inhaling. Know both the desired result and side effects of the drug. Do not take over-the-counter meds or any other medication without consulting a doctor first.
Knowing so much about this aerochamber makes me feel so much more comfortable using it. Thanks for showing me.
I'm glad to hear that. I'm here to ensure that you're aware of the process, provide assistance where needed, and ease your anxiety. So let's pop it open. Since I already sprayed it, you don't have to do that anymore. You're going to waste a lot of medication. You do that when you first get it so you can clear the nozzle. So what's next? You're going to attach it to the bottom. Shake it for 10 seconds.